Hi, I'm Dr. Johnny Rose with the Cuyahoga County Board of Health. I want to talk to you today about a dilemma that nursing homes and long-term care facilities are facing in the midst of the COVID crisis, and that's around staffing. Now, a lot of staff have been exposed or have themselves become infected with COVID-19. And when this happens, there's of course a quarantine or an isolation requirement. Quarantine for those who have been exposed, isolation for those who are known to be infected. But this can cause dilemmas when it comes to maintaining adequate and safe staffing. First, let's talk about the CDC return to work criteria. For quarantined individuals, people who have been exposed to a known case of COVID-19, the recommendation is quarantine for 14 days. For infected individuals who are under isolation, the recommendation is that in the last 72 hours, the individual should not have had any fever, no fever-reducing medications, and decreasing respiratory symptoms. They may retain some sort of cough or something for quite a while. And in the last 10 days, it should be at least 10 days since the onset of symptoms. So those are the symptom-based criteria. There is a timing-based criteria for individuals who never develop symptoms, and that's simply at least 10 days should have passed since the positive specimen was collected. There's a third testing-based strategy that CDC no longer recommends as the primary strategy, and we don't recommend it, and that's the test-based strategy where one should have 2 consecutive negative tests 24 hours apart. Experience is showing that these individuals are staying positive for a long time, so we do not recommend that. The reality is that abiding by these recommendations, while it would be ideal, is just not practical in a lot of cases in order to maintain appropriate staffing levels. And in fact, this can discourage facilities from testing as they should, because as we know, testing is really at the center of mitigation. So what CDC recommends and what we recommend is that in scenarios when other strategies for maximizing staffing have been exhausted, so extending shifts, reducing elective off time, those sorts of things, when those have been exhausted, you can look at your staff members who are under quarantine. And individuals can come back as long as they haven't developed symptoms before their 14-day quarantine period ends. Now, when and if they do come back, they should be wearing a surgical mask at all times except when they're eating. When they're eating, they should be separated from their coworkers or any patients. For individuals who are coming back before their 14 days, it's better the later that one can wait until the last exposure to a COVID positive case, the better. Because as we're finding out, the shedding of the virus tends to wane pretty quickly after the onset of infection. Now, if there are individuals who have tested positive for COVID, but who have not developed symptoms, and all your other staffing measures have been exhausted, and you've sent quarantined people back, and you still are going to be understaffed, under the guidance of the health department, you can consider sending back individuals who have tested positive but who have not developed symptoms. And of course, they need to be wearing surgical masks, and they need to, if possible, not be in contact with immunocompromised patients. To the extent that their roles can be adjusted to maximize to distance and minimize contact with patients, the better, realizing this isn't always the case. Another strategy that one can use is to use these asymptomatic COVID positive patients to work exclusively with COVID positive staff to work exclusively with COVID positive patients who are in a dedicated COVID unit. But again, this is something that should be used as a last resort. And if it does need to be used, one should wait as long as possible after positive testing. Any of these steps, we do highly recommend that you consult with the Cuyahoga County Board of Health because we're having a lot of experience with these clusters, and we can help you think through the strategies to minimize your staffing issues and also minimize the risk to staff and patients. Now, these guidelines are continually changing, so be sure to check your CDC and ODH websites. And if in doubt, please feel free to give the Cuyahoga County Board of Health a call, and we can discuss your situation. Thank you.